My name is Amy, and I am the National Tuberculosis Program Director of Singapore. I have to make sure TB never gets ahead of us. To do that, I need to know whether TB notifications and incidents are going up or down, which age-sex groups carry the highest burden, and whether our BCG program is holding the line. For years, answering those questions meant chasing numbers in spreadsheets, PDF reports, and email threads. In this video, I want to show you how that experience changes when I work inside Amazon Quick Suite. I log into Amazon Quick Suite. On the home screen, I see the TB Situation Overview Quick Site Dashboard and the TB Program Director Chat Agent. My first task is to understand where we stand. The visuals answer questions that used to take me hours. I see a trend of total TB notifications by year, the overall TB incidence rate per 100,000 population, TB deaths, and BCG coverage over the same period. I am answering the core question in my head. In which population groups is TB refusing to let go? The data backing up the dashboard are stored in one place. I open space that is built by data analysts as a single source of truth. Everything here is about tuberculosis. Because this space is curated and the retrieval engine is restricted to it. Every answer the system gives me later is grounded on these sources, not random information from the internet. Later, my assistant tells me the minister wants a short update before a regional call. No slides, no long report, just a concise email that explains the current TB situation and any signal he should be aware of. Instead of starting a new document, I open the flow called TB Health Brief Generator. On screen, I see the welcome message. In the input box, I type, "Prepare a short email brief for the minister on TB trends in the last 5 years, focusing on working-age adults and any recent changes in BCG coverage." The flow interrogates the same quick site dashboards I was just exploring, pulls the numbers for notifications, incidents, and BCG coverage, identifies the main trends, and assembles them into a structured email draft. Then, I turn from outward communication to internal strategy. We have a session with epidemiologists and program managers, and I want sharper answers than slightly up or mostly stable. I open the TB Program Director Chat Agent. It knows about our TB incidents, notifications, and BCG coverage, and it has access to the same definitions and dashboards I see. I start by asking, summarize TB incidents and notifications for the last 5 years and highlight the largest year-on-year change, with one paragraph of interpretation. It tells me how notifications and incidents have moved over the period, points out the year with the sharpest change, and briefly explains what that might mean. I am still in control of the decision, but I no longer wait for days of back-and-forth emails to frame the problem. Once a quarter, I need to go deeper than a dashboard view or a short email. I am expected to provide a more comprehensive assessment of how we are doing, not just what the numbers are, but what they say about program performance over time. For that, I open Quick Research, Tuberculosis in Singapore, Epidemiological Trends and Program Performance Assessment. This template uses the same TB incidents, notifications, and BCG coverage datasets that drive my dashboards, the flow, and the chat agent. Later, I can export it into a more concise format that can be sent to executive or different audience. Amazon Quick Suite does not replace my judgment or my team. What it does is remove the friction between data and decision. It turns our TB data from something we struggle to assemble after the fact into something we can lead with every week in real time.